All right. Good evening, everyone. Welcome to the June 10th Program and Budget Committee meeting. As thunder roars in the background, just as I'm saying that, I'd like to begin by reading our mission statement. Macomb County Community Mental Health, guided by the values of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, I will take a motion to adopt the agenda.
So move.
Burke.
Support.
Motion from Shimatero and support from Burke. Any questions or comments? All right, seeing none, all in favor signify by saying aye.
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 The agenda is adopted. Next, we will move on to hearing of the public. Anybody from the public wishing to speak about any item on the agenda, you have 5 minutes. Give us your name and address. And unmute your phones. Hearing of the public going once. Hearing of the public going twice. Third and final call for hearing of the public. There is also one at the end of the meeting as well if you don't jump on in time. All right, hearing none, we will close the first hearing of the public and move on to item 5A, a request to approve renewal of agreement for DHHS worker. I'll take a motion to approve.
Move to approve, Linda Bush.
Phillips. Second.
Motion from Linda, support from Lori. Dave, did you want to speak to this item?
Yes, we have an employee of the state of Michigan, Danielle Gorney. She's been working with us since October of 2017, and we did have a DHHS worker prior to that working in our office as well. So Danielle is our resource person for everything Medicaid. She helps people get qualified for their Medicaid spend down, to process Medicaid applications, either initial or referrals. What you have in your packet was the previous contract that was signed, and we do expect the new contract to be over on my desk prior to the our next board meeting. So I'm asking permission to approve the new contract. It's just a renewal continuation of what we've had in place for years.
Thanks, Dave. Any questions or comments?
I have one, Phil.
Kathy, go ahead.
You said it's just a renewal of this, so all the wording will be pretty much the same?
Yes, I believe so. I haven't seen the new one yet, but I'll do a side-by-side comparison. And if there's any significant changes, I'll come back around.
Yeah, just let us know at the next meeting, yeah. All right, thank you.
And I just want to say, I know Danielle, and she is phenomenal and an asset to CMH to help those navigate the system.
Great.
Thank you, Lori. Any other questions or comments on this item? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Next is item 6, receive and file. I don't believe there's anything to receive and file, Dave, unless there's something.
No.
Oh, okay. 7 resolutions. There are no resolutions at this time either. So we will move to item 8, other possible agenda items. Dave, do you want to start? Do we start with Richard? I don't care the order.
I'll let Richard do the cleanup. His is probably more interesting. But Mark Hackle came out with the announcement that he would not be renewing the emergency order after June 26th. We do have a reopening plan in place, thanks to Tracy Smith, our chief of staff, who has done a tremendous amount of work in that area. So we're still operating on a skeleton crew in the administration office, and we will be, right now, when I came into the office, had to have a mask in the public areas and have to sign a form that I did not have any symptoms of COVID. That's in place across our entire agency. And we're working on bringing staff back based on their need to actually be in the office. So we've gone out to each of the departments, the supervisors and the directors, and we've collected all that information, and it's in one comprehensive reopening plan right now. We did receive another pallet of personal protection equipment from the state today. So we have quite a bit right now, and we are monitoring and tracking that, and we are making that available to our providers as we're able to. We also today received a new contract template from the state of Michigan for our PIHP contract. It's a large document. There's an extensive crosswalk that says, you know, this information was in your prior contract. This is where it is in the new template. I did send that to Aaron Thomas, Corp Counsel, as well as in-house staff for review. And I'm trying to, that'll be my midnight reading for my insomnia purposes later on as well. So we'll have more detail, and there'll be follow-up discussions with the PIHPs to make sure that everything that we were expecting to be in there is in fact in there. One of the newer developments was the provider stability plan. I will send that to you, to the board members. So what had happened was the state was looking at a system redesign, if you recall, and they were looking to put SIPs in place statewide in place of the PIHPs. Then the COVID pandemic hit, and then they were discussing, we never got anything official, but they were mentioning possibly changing the PIHP contract for the current fiscal year retroactive to October 1st and making significant changes, including changing our risk reserve corridor to 2% and requiring us to contract with all of our providers under a subcapitated arrangement and pretty much pushing money out onto the provider system. We all responded, and Richard was key in our response to the department about why we didn't think that was a good idea. And we were successful. So the Behavioral Health and Developmental Disabilities Administration went to bat for us. They got that taken off the table, and in its place is a provider stability plan, which is our response to the state about how we're spending our funds and helping the provider system continue to be stable for the stability plan during the COVID crisis. So we did that response. It included things like the $20 a day increase for the license settings, the removal of the prior authorization process for the community living supports, because there needed to be adjustments when the schools were closed and the skill building sites were closed down. We opened up our general fund benefit for April and May so that people did not have a negative impact due to delays in staff working remotely now. The premium pay that were still underway, the $2 an hour premium pay for the direct care workers, and some other items and stuff as well. I have to provide the state an update on that in 2 weeks from last Friday. and then it'll be a once a month update for the remainder of this fiscal year. And so they're monitoring that pretty close. But I will get that detail out to you for your review. Thanks to Jim Losey. Jim was a big part of our reason we got the CCBHC grant. He did a nice follow-up, and we did submit for the FCC grant, which is to provide us some funds for technology during the COVID-19 crisis. So when we move services remotely, we could use these funds on any of the tech equipment that we purchased, spent money on in order to allow staff to work remote during the crisis. So we don't have that yet, but all the paperwork went in. Then on a similar note, I had mentioned before, and Richard, I don't know if you'll comment on this at all, kind of our year-end spending. We do have the $270,000 in general fund from the state of Michigan. I have been talking to Steve Schmiegel, and we are trying to set up a discussion about those funds. Did receive a Q&A from the state that helps clarify how those funds can be spent. And I did receive from the county some additional details about the $1 million in the CARES Act money that's available to us as well. So we'll be putting together a detailed spending plan and updating the board and keeping them updated on that as well. That's my report.
Just, Phil, if I can,
Go ahead, Nick.
just one quick question, David. You indicated that the end of the month will start reopening because of the exec's order. Is there any guidance being given as to additional precautions that'll have to be taken by people as they return to work? Mask, cleaning, social distancing, all that good stuff.
Yeah, that's all in our reopening plan and in excruciating detail.
Okay.
And I commented on it when I came in the office today. You have to have a mask to enter our building. And whenever I leave my office and I'm in a common area, I put a mask on. And then you have to complete a hard copy symptom checklist.
That will remain after the emergency is over?
For a period of time, yes, until
Until they're
further
getting
actions
off.
are taken.
Yeah.
Yeah, and it's not going to be on June 27th. Everybody's back to working in the office. We still have a lot of, and I did clarify at the state level as well. The telehealth codes that were so instrumental in allowing us to move our services to telehealth and remote. From what I had heard, they would stay in place 30 days after the end of the state of emergency. But the federal government came behind that and took that requirement away. So there's no 30-day clock ticking, and we should be able to continue to provide the telehealth case management supports coordination into the foreseeable future. So that was real good news.
Some of the reports we saw said that some of the looks like, and it's probably something we should check into, but it looks like some of the working from home actually increased productivity. It would be interesting to see that down the line. And I only ask in terms of how we're reopening because several states that were less cautious in reopening, and Michigan are now seeing surges again, and the governor's made it clear that if she starts to see surges, she's willing to reinstate limitations. So I'm just asking to make sure we're doing this as safely as possible, both for humanitarian reasons, but also for practical reasons.
Yes, we're being very cautious and we're moving very slowly. We do expect, because of the unemployment rates, the needs will actually start to, we expect to see a spike in service request. We have not seen that yet. Our calls to the call center have actually decreased. We think this is the lull before the calm before the storm. So we're getting ready to do that. I made mention of that in the stability plan that went to the state. There was another factor in there too, but I'll share that with you, like I said, and you'll see the detail we have. And then as the updates go out, I'll share those as well.
Well, we saw in Adam's report that there wasn't a spike in the crisis center calls, which I think was pretty surprising, but you may be right. It just may be a lull in the time between they start to need services and actually reach out for them, and we'll just have to wait and see.
Yeah. We're tracking it closely.
Thank you.
Any
Thank
other
you.
questions for Dave before we move on to Richard?
I'm going to stop my screen share so Richard can take over.
Perfect.
And while we're doing that, is everyone able to hear me okay?
Yes,
Yes.
sir.
Excellent. I'll get my screen
Yep.
share started. And are you able to see the April monthly finance report on my screen?
No, not yet. We just see a Zoom.
All right, let's try this one.
There you go.
There you go. Yep.
All right, excellent. So this is our second monthly finance report, and so this will be more of a traditional look at how I will typically present the finance report. So again, wanting to hit some of the key highlights of what we're seeing through the month of April, some of the projections that we have related to the information. Again, any feedback that you have on how the presentation is delivered or the information, I'm very happy to try to incorporate that into future presentations. So page 1, we have our revenue trends, and as we mentioned last month, we did expect a spike in the month of April related to that one-time retroactive rate adjustment that took us from October through April. May is slightly above the October through March levels, which is also expected, as that new rate going forward will be not as large as the spike, but will be larger, so additional revenue. So good news as we're looking at the revenue trends that we were expecting, so that's in line. As we look at the eligible trends, I'm a little surprised that we're not seeing more spikes from April and May related to the increase in the unemployment. There could be a couple of reasons for this. One could be related to timeliness of the department with the furlough days that they are now taking and their ability to process the paperwork for applications. Part of it could be that the additional federal dollars related to the unemployment may be enough where we're not seeing as many Medicaid eligibles. So we're going to keep our eye on our eligibles. Again, we can see retroactive eligibility, typically not within 90 days, but technically up to 6 months. So we'll be keeping our eye on that and see if we start spiking our eligibles. Moving on to our comparative charts for our balance sheet. One of the things that we did identify and correct this month compared to last month is some of the cash and investments and the liabilities. As I had mentioned before, both looked pretty high. We were able to identify some of the reasons why that was happening in the ledger and correct that. So I do believe this is a more accurate representation going forward. We are showing cash and investments about 12 million higher than where we ended last year, which makes sense based on the amount of unspent rep funds that we are seeing through this point of the year. Receivables are down about 5 million, and then other assets are close to even, so down a little bit from 1.5 to 1.1 million. On the liability side, we do see a reduction from last year end 26 million to current 16 million. The primary reason for that is because at the end of the fiscal year, we do keep accounts payable open for a long period of time. So we do see that accounts payable balance higher at year end. So at this point, the 16 million that we're showing is primarily related to claims that are paid to our providers after the end of a month, but the date of service is in that month. So we had approximately $17 million of claims that we estimate are sitting out at the provider that we had not paid by April 30th, but were related to dates of service April 30th and before. The impact then of our total assets and liabilities is an increase in total assets of about 6 million and decrease in liabilities of about 10 million for through April, an increase in our net position of about 17. Moving on to the income statement, as we look at our revenues, again, just a reminder, in the previous page, we were looking at year-end September 30, 2019 compared to April 2020. At this point, when we look at the revenues and expenses, we are annualizing our April information, so we're to be comparative. So as we annualize April, we appear that we will be about $20 million higher this year in revenue for capitation. So that's our Medicaid, Healthy Michigan, and our My Health Link revenues. State general fund and our SUD block grant is down a little bit, about $1 million from when we annualize that. And some of that is a change of how our SUD block grant is being paid to us this year. So in the past, we got an equal 1/12 payment every month. In this year, we actually have to request the money from the state of Michigan, and we get the SUD block grant as a reimbursement. So there's actually a timing difference on how quickly we get that money. So by the end of the year, when we have all of our receivables booked, I anticipate that we will be pretty close to that 14 million that we saw last year. So just a small timing difference here. Same with the county funds. Again, we haven't received, a lot of the county funds get calculated and transferred closer to the end of the fiscal year. So we do anticipate we will see more of those county transfers, both related to the Public Act 2 funding for SUD and our county appropriation for our mental health match that's required. So again, timing issues at this point in time, but by the end of the year, I expect those to be similar. And then our all other revenue sources primarily related to grants, again, timing issues. The end of last year would be fully accrued, and at this point, we're just showing cash receipts annualized. On the expense side, we're looking pretty consistent year over year. So again, in red, we have last year's annualized and this year's projected. There could be some timing differences where invoices related to April may not have been paid until May or early June. So as we annualize, there can be some of those small timing differences, but in general, as you can see, the numbers are pretty consistent. The biggest difference we do see is in the all other, and some of that does have to do with the county charges. So at the end of last year, of course, this 13.9 includes all of the county charges for the centralized services. And through this point of the year, we have not been charged anything yet. So that typically happens at the end of the year. So again, a timing difference that can occur because we haven't seen what those charges will be yet. So looking at total revenue increase and again, a small expense decrease, but again, I think that's timing differences. So I do expect our expenses to pop up to be closer to that 223 million at this pace. We would show about a $17 million surplus by the end of the year. I anticipate that 17 million surplus will be probably closer to like 14 million with some of those additional expenses that we're not seeing in our current annualized numbers. I know that was quick. Any questions on the projections before I move on to the provider trends or the funding summary?
No.
So we do have an updated top 10 mental health providers for April of 2020. Most of the same names that we saw on there last month. We have our top 10 for mental health, and we also do have the top 10 for SUD. And what I've added this month is a page that specifically outlines the provider name and a summary description of the primary services. It's not a comprehensive list of all the services that they provide, but at least a summary of the primary services that we are paying for within that dollar amount. So, like for example, morgue, the vast majority of the dollars we spend is related to licensed and unlicensed residential, but they do provide other ancillary mental health and IDD services. Similarly, for our top 10 SUD providers, names and the primary services that they're providing. This page is new. Oh, go ahead.
Sorry. I was just going to say, Phil, is it okay if I say this?
Yeah, go ahead.
Okay. I really like that, Richard. That helps a lot too, especially like I know it's already been a year on the board, but that really is very helpful for me in just understanding all the different names. Like I do really appreciate that page a lot.
Excellent. No, that's what we want to be able to do, is just, again, help connect some of the dots. It's a very complex system. We recognize that. And so, again, if there's anything that, as you look at it, you're like, I'm not sure what that means, please feel free to ask.
Absolutely. Thank you.
Again, any other questions about this? I know it's a new page. Just want to make sure that I've got given an opportunity for feedback. All righty then.
I have a question on Henry Ford. Is that all general fund, or that's the net of general fund? Are there additional expenses paid there that were paid through the people we serve through their insurance?
So the amount that would be paid to Henry Ford would be the inpatient costs. Typically that would include all funding sources, so Medicaid, Health of Michigan, State General Fund. And if there was a primary payer, so if they did have Blue Cross or Medicare, then, well, I shouldn't say Medicare, I forget, you guys are my health link. But if they do have Blue Cross or another primary payer, then yes, we would pay them less the coordination of benefits amount paid by that primary payer. Does that answer the question?
Okay, so that could show up somewhere else then. With the concept of what you just talked about, the coordinated benefits might show up under another vendor too.
So any vendor. So these numbers, right? It's possible that when we talk about Henry Ford, we've paid them, $2 million. It's possible that somebody else, Blue Cross, for example, has already paid them a few $100,000 in addition to that, and we won't see that on these reports. This is just what CMH is their responsible portion.
Right.
And that would be true for any provider that would have a coordination of benefit amount. Yes.
Okay, so it's not the gross amount, it's strictly what we are required to pay them.
That is correct.
Okay, thank you.
So moving on to our summary of revenues and expenses by fund source, then for Medicaid through the month of April, we're looking at just under a $9 million surplus. And again, this is Medicaid not including autism. Our autism through April is about a $4.7 million surplus for a net combined Medicaid surplus of $13.6 million. We're also showing a Healthy Michigan surplus through April of about $1 million. And then a state general fund surplus through April of about $1.8 million. I did add this section to the bottom, and I was trying to capture what I think you were asking for, Nick, last month, which is this is our beginning balance of our risk reserve and our savings. This is how much we're allowed to carry forward or move from one fiscal year into the next without having to lapse money back to the state. So our beginning balance coming into the year is 10.9. The surpluses above currently is 14.6 million. So we would contribute those if the year were to end right now, which we know it won't, but if it were to end right now, we would contribute those into that risk reserve and savings. And so then our ending surplus available to carry into next year would be about 25.5 million. And then I've estimated our contractual limitation. So this is how much, assuming approximately $210 million of Medicaid Healthy Michigan combination revenue. This is our contractual limitation that I'm estimating at the end of the year, 7.5% into the risk reserve, 5% into savings. So a maximum that we can carry from one year to the next of about 26 million. So we're just barely under that at this point in time, but we're very close.
Gotcha.
Does that capture what you were looking for?
Yes, thank you.
Perfect. Any other questions on this page or concerns or? Okay. The rest of the report is a lot of detailed numbers that, again, they sum up into the charts and graphs that we've already reviewed. So unless there are, I mean, I have no specific highlights that I haven't already talked about of these pages, but I'm happy to take any questions that you have either tonight, or if you wanted to send an email with any questions, I'll try to respond to those as quickly as I can.
Thanks, Richard. Any questions from any board members? Okay.
I have one, Bill.
Okay.
Will some of these numbers now tie in to the county's year-end statement? Will we be able to match some of these numbers? Do you know?
So when the county's year-end financial statements are done, we will be able to match this balance as of September 30, 2019. We will be able to match this column to the issued CAFR. So I do know that the county is making some adjustments related to pension and the retiree health care that will change these numbers. So as soon as they make their adjustments for the CAFR, we'll incorporate those changes into these numbers as well so that they do match.
Okay, so it sounds like even on the income statement, it'll be the similar type things to the year-end revenue and expenditures.
Correct.
And so for budgeting purposes, it'll be looking at the same thing. Because in the past, as a county commissioner, I would try to match these when I was a county commissioner, and also on this board, I could never match anything up. But I know that was something that Steve wanted to try to do more than had been done. So you're working together on that?
Yep, I've had conversations with both Steve Adair and Steve Schmiegel about the expectation that these would match the final issued CAFR report.
Great, thank you.
This probably more Dave.
Phil, I'm raising my hand. Can you see it?
No.
No.
I have a question.
Linda, go ahead, and then Nick.
Oh, sorry, Nick. I'm sorry. David, this is for both of you. The 270,000, I think it was COVID general fund money, or general fund related to the COVID situation. Is that for this fiscal year only, and is it use it or lose it? You know, I don't like to. I'm very serious. We're all very serious about not giving back general fund money. Thank you.
So yes, it is for, my understanding at this point, it is for this fiscal year only, and they do have very specific limitations on what we can use it for. And my understanding, my understanding at this point is yes, it's use it or lose it. The state has been talking to the CFOs of the CMHs about sitting down and reviewing the final financial status report that we're required to submit every year and looking at the formula that they're going to actually build into that document to capture how that's going to work. So until that work group meets and we figure out how that's going to work, it could change, but that's my understanding at this point in time.
Okay, if we could just hear in a month or two then what the outcome of that was, that would be good. Thanks.
Absolutely.
Nick, go ahead.
As I went through the packet online, because that's where I did it this time, this wasn't in there, and maybe I missed it in the emails, or have we got a copy of this?
Yeah, I'm gonna apologize. I sent it out about 1 o'clock this morning.
Oh, okay.
Bring it linked to
I
this.
just missed it.
So one of the things that I'm trying to do is look at the process that we need to go through, because in order to produce these documents, I have to have information from Focus, our electronic medical record system, information from the GL, that all play nicely together. And so things have to happen in a very specific order. So I'm trying to get a process in place that will put this in your hands at least the week before the meeting.
Yeah, well, one of the good things here is this is a program budget. We have a full board in a couple of weeks. So we have time to review it. If we have questions, we can email them to you or ask you that.
Yeah.
So, thank you.
Thanks, Nick. Any other questions or comments from board members? All right. Thank you, Richard. Appreciate it.
Absolutely.
Dave, did Adam have anything to add, or are we good?
No, I think we're good.
Okay. Any other possible agenda items from board members? Kathy?
Thank you, I do. And that is, it was brought to my attention, I need to make committee assignments again. I kind of forgot about it because we have the same board members. And what I would like to do is just have everybody remain the same unless somebody wants to move. They maybe want to be on an additional committee or don't like the committee they're on or something. But I'll have all that at full board. I'll have the full list. In fact, I can have it sent out before that so you can take a look at it. So something for the board members to be thinking about in the next week before the agenda goes out for full board.
Thank you, Kathy. Any other board members with anything else? All right, seeing and hearing none, we will move on to hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Give us your name and address. Make sure you unmute yourself. Anybody from the public? Hearing of the public going once. Hearing of the public going twice. Third and final time for hearing of the public. All right, seeing and hearing none, we will close hearing of the public. And with that, we are adjourned. Everybody have a good night.
Good night.
Good night.
Good night, thanks,
Thank
Bill.
you.
Hey, good night, everybody.
Stay dry.
Stay safe.
Good night.